Observe as I inject the soft tissue pygonium or anterior aspect of the chin with the supplied needle in the supraperiosteal plane. Investigators in this trial can inject up to 3 boluses, each 0.5 ml or less, in the pygonium. The injections may be performed using either depots or the cone injection technique, which is also known as the column technique. Insert the needle tip perpendicular to the skin surface and advance in an anterior to posterior direction until you contact the periosteum of the mentum. Just before injecting, the plunger rod should be withdrawn slightly to aspirate and verify that the needle is not intravascular. I then begin injecting depots or cones. Be careful not to inject into the mental artery, which exits the mental foramen. My goal in treating the peconium is to achieve greater projection of the chin and bring it into balance with the lower face. So for the peconium, for the first injection point, it will be right in the midline with a depot injection of 0.2 mLs. Then I'll do one injection off to the right lateral side and another to the left lateral side, each using a small depot supraperiosteally with about 0.15 to 0.2 mLs. After injection, you are able to gently massage or mold the gel. Repeat this process for each injection while constantly assessing the results the treatment is providing. As with all Juvederm Voluma XC treatments, correct to 100% of the desired volume effect, but do not overcorrect. I will now move on to injection into the menton, or inferior aspect of the chin. In this case, investigators can inject with the supplied needle or the provided microcannula supraperiosteally or subcutaneously, using multiple small boluses of up to 0.5 ml per bolus. Again, make sure to avoid injecting into the mental artery, which is located laterally to the apex of the chin. It is important to always aspirate prior to injecting. To do this, I insert the needle tip and then withdraw the plunger rod slightly, ensuring that the needle is not intravascular. As I treat the menton, I will aim to taper the correction so that the treated area of the pygonium transitions smoothly below the chin. Additionally, I lengthen the chin for achieving proper proportions of the lower face. Treating the menton with these goals in mind can add to the overall aesthetic improvement of the treatment. When we're injecting the menton, we injected 0.25 mLs supraperiosteally in an inferior to superior approach. Now, let's inject the pre-jowl sulcus on the left and right side. If injections to the pre-jowl sulci are desired, investigators may use the supplied needle or the provided microcannula using a subcutaneous fanning technique. Again, always remember to cleanse before injection and, when necessary, gently mold after the injections. Structures in this region that must be avoided when injecting include the facial artery and facial vein. The facial artery crosses the body of the mandible and gives off the inferior and superior labial arteries. Treating the pre-jowl sulcus can have several benefits. Whereas men may want a more square jaw with a wider chin, women generally prefer a more heart-shaped face with a narrow chin. So for women, I am careful not to widen the sides of the chin too much. Where needed, I will inject lateral to the chin to taper the correction of the pygonium for a smooth transition to the sides of the chin. And lastly, I add product to reduce the severity of the pre-jowl sulcus. All of these can improve the aesthetic results of the chin treatment. After making a small incisional entrance with a needle, I'm using a small cannula, inserting through the opening and then doing a fanning technique, going up, middle, and down to treat the pre-jowl sulcus. In total, I use 0.25 mLs of Juvederm Voluma XC in this area. So on her left side, I made an entrance incision with a needle here, and then I used a 1-inch cannula using a fanning technique to deposit 0.25 mLs of Juvederm Voluma XC in the lower mid, and superior aspects of her prejowl sulcus.
Oh my god, that looks so much better. Like it's just kind of like given it a lot more shape to it all, which is really nice because I felt like I had all these like annoying lines and stuff like that, and I wasn't actually, no offense, I wasn't expecting it to look as good as this. Like it looks great. It looks like so perfect.
Never forget to aspirate when placing deep to avoid affecting blood vessels. You remember this.
Let's do some of the chin area here, hey? And actually point some. Okay, so this part does hurt a tiny bit. Okay, so we're getting deep over here. Very, very subtle. Very subtle, guys. We're not changing her features. She's still going to go through passport control without any problems because we're not changing things. And it's a slow injection point here. So once again, guys, I'm just decreasing the shadowing in that area. Okay, I'm not changing much in the way of features. Just decreasing the shadow in that area. Now this bit is into the mental crease. So what we'll want to do is actually point the chin a little. Okay, so there's little aspects which we'll work with. And I go straight down there. This is down to the bone, but it's a very well tolerated injection. Very slow. I'm not aspirating here, but going very, very slow. I'm just building up her chin a little bit because I think giving her that point will make everything in proportion and harmonious. We don't want one aspect of her face to stand out, but everything in harmony. Guys, you know I love lasering, but I reckon I love this so much because filling is an art, while laser is a science. It's a very, very slow technique, very slow injection. The slower it is, the better. Using the lift, we can actually mold it very nicely. And I'm using 2 mils on her in total. Nearly done here. Cool. Okay. Done some chin around there. Feels a bit weird, hey?
Mm.
Yeah.
Feels heavy.
Feels heavy, yeah, but looks good.